Welcome, members of the Hosa community. So, our Hosa topic for today is creative problem solving, created by myself, Raeed Monnan,
Sid Rawat.
and Anish Anne. So, in our presentation today, we're going to be going over several examples and several solutions as to why COVID-19 is a major issue today.
To start off, what is COVID-19? COVID-19 has been around for several years, but only amongst animals. It has only recently been introduced to humans. The COVID-19 is a very deadly and infectious virus, and the government is doing everything in their power to stop the spread. They tell us to wear masks. They tell us to stay 6 feet, and they try their best to stop social gatherings. We're gonna go more in depth into that in our presentation. Some worldwide COVID-19 statistics are there's 74 million total cases and 1.6 million total deaths. Some symptoms of COVID are loss of smell, difficulty breathing, and arrhythmia. Arrhythmia is an irregularity in your heart. Your heartbeat could be faster or slower with arrhythmia, and this could be very, very dangerous for you. The last thing is duration. The COVID-19, like mentioned before, came into the United States around 11 months ago, in March 2020. And from March to June, there was a 4-month United States lockdown to have the citizens stay inside, quarantined at home to stop the spread and make it less deadly and less casualties and less people getting the virus.
So we're going to be discussing 4 lenses. I'm going to be discussing students, which plays a major role in this COVID-19 virus spreading. One rule that students don't follow is that they don't wear masks. According to the CDC, wearing masks is very beneficial and it can help prevent the COVID-19 virus from spreading. Another rule that students don't follow is exceeding the social gathering limit, which is 10 people indoor and 25 people outdoor. Students also fail to follow the CDC social distancing guidelines, which is interacting with people 6 feet apart. Many students also go outside without realizing that they have the COVID-19 symptoms. And last but not least, many students also fail to follow the proper sanitary regulations, which is washing your hands properly or sanitizing public areas. Another lens I'm going to be talking about is the citizens of the United States, which also plays another major role in spreading the COVID-19 virus. Compared to young adults and senior citizens 65 years or above, they tend to be hospitalized up to 13 times more. The death ranges are from 90 to 630 times more higher. And children with COVID-19, they also their symptoms are asymptomatic or they have mild symptoms, which can be harder to tell if they have it or not, which can increase the spread of the COVID-19 virus.
So, our next lens is doctors, and we're going to be talking about the causes right now. And so, one of the main passageways in which COVID-19 travels is airborne travel, which means it can travel through the air. And so the COVID-19 virus has particles of droplets and smaller particles when compared to other viruses like the flu and other diseases. So an infected person of coronavirus will breathe, and any person that is within 6 feet, if they inhale those small particles, they will attract the virus. Another way they can get the virus is if an infected person touches an object and then an uninfected person touches that same object, those particles will go on their hand, and if they touch their mouth or their nose or any way that leads into their body, they will attract the virus in that way. Now we're going to be talking about the results. So the COVID-19 virus has many symptoms. One of the main ones are fever, cough, body aches, and sometimes vomiting and diarrhea. Another major symptom is pneumonia, which occurs within smaller children and older people, ranging from 65 and up, so senior citizens. And this is a major problem because that is the age group that is mostly affected by COVID-19. And then another factor is that COVID-19 is not treatable with antibiotics like most other infections or diseases. So the R0 factor plays a role. So the R0 factor is the reproduction rate, which means, for example, if somebody gets COVID-19, how many other people can that infected person affect? So when comparing that factor with the flu can only infect one other person. But when in the case of COVID-19, if somebody's infected and they walk into a room with, say, 25 other people, for example, any person that is within 6 feet of that infected person will get infected. So it generally infects more people.
Finally, our last lens, people of power. The United States government have done everything in their power to stop the spread of COVID. One thing they've done is they promote using masks and staying 6 feet apart. The President of the United States wears his mask at rallies and in presidential election debates and all that, and he also advises to stay 6 feet apart. Another thing they do is they've managed to close almost 60% of businesses across the United States. This includes gyms, restaurants, and any social attractions to help citizens, instead of going out and socializing, to stay home, stay quarantined, and stop the spread that way. Another thing they've done is cities with multiple amount of cases, numerous amount of cases, for example, Michigan, they have put the city on lockdown to help people stay quarantined and stop the spread that way. For example, Michigan, the Governor Whitmer, she assigned a lockdown. And finally, they've limited gatherings. So hanging out with your friends, going out to restaurants, going out to play basketball, going out to do any of that, it's all limited. Any family occasions, all limited. There's only a limited amount of people you can hang out with, and especially cities like Michigan that have multiple cases, that they take that very seriously, and the cops can even be called on you if there's multiple cars and multiple people in your house.
So, after analyzing all of these lenses, we have concluded that COVID-19 is a very serious matter, and students should be taking this matter a lot more seriously than they are currently. People of power and just citizens in general are creating these rules and regulations for a reason. It's not just for certain people to follow and certain people to not follow. So, in order to really make a change, students need to be advised and start to follow these rules and regulations. For example, the main one is just wearing masks when they go out in public, small gatherings, not going out unless it's necessary. For example, if there's a medical problem or a family issue, then it's obviously allowed. But we should also advise students to spread that knowledge to people who are not aware of these rules and regulations in order to make a greater impact on the world.